Water itself is actually a very powerful cleanser, and you don't need to go the extra mile to further aggravate the situation and irritate your skin.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I've been doing pretty well. Just been thinking about, winter's right around the corner. It's getting cooler and cooler. What are we doing with our skincare these days?
Yeah, I agree. Probably one of the most common questions I get is about what to just do with my skin on a day-to-day basis. I mean, people who come for, a skin exam, a cancer screening, they don't really have any particular skin disease. And they most commonly will ask you, hey, what's good for my skin? And I think we learn so much about disease and pathology, we kind of forget what to do with a normal appearing skin. I mean, it's kind of confusing, mind-boggling when you think about it. We spend so much time and effort. I think we need someone to shepherd us through this maze. What do you think?
Absolutely. And we have an expert today, Dr. Yuval Bibi, and he is a board-certified dermatologist, also an author of Sick Skin, Skincare Made Simple. It's a #1 Amazon bestseller. And welcome to the podcast because we're excited to talk to you about skincare.
Thank you, guys. It's great to be here.
And so maybe, Yuval, I want to go back for a second and ask, you're an accomplished dermatologist, was an investigator earlier in your career. And of all the things you're focusing on kind of normal skin, why don't you just find a disease and focus on it, my friend? What attracted you to this?
That's a great question, Hadar. So what really attracted me to focusing on normal skin is what I've noticed in the course of my career. And this started early on in residency and training and basic training as a baby dermatologist. I noticed that people were doing an awful lot to their skin while their skin was normal and actually healthy, that gradually, slowly but surely started hitting me as largely unnecessary. What I noticed is that people tend to do things almost as an automatic practice. They tended to use products on their skin or take care of their skin in a very automated way. It seemed almost prescriptive, like it was coming from somewhere. And as I delved deeper and deeper into the phenomenon of modern day skincare, I was struck by the myriad or the very large variety of things that people do to their skin that are first of all unnecessary. Second, they are a great waste of time and money and heartache because they do expect great results and they seldom get them. And third, those unnecessary practices, besides being a net negative just by the bare minimum waste of time and money and heartache for not getting the results, those products and practices can actually lead to skin damage and can actually put someone in the hole when their skin is actually normal to begin with.
Yeah, that is so true. What I would like to do just for our listeners to kind of give us a sense, give me your top 3 kind of pet peeves when it comes to mistakes that people do. Because I think it's easy for us sitting in the clinic every day and seeing people doing certain stuff that may be excessive in our opinion. But for people who are listening, they may not have a good idea. Can you give us some examples that illustrate your point?
Absolutely. So the first thing that people are struck by as amazing is that the temperature of the water that they use to bathe is usually way too high. It's actually scalding their skin. And we're talking about the hot water lovers. And maybe it's just me that I attract hot water lovers. But people who come to my clinic are usually stunned at the recommendation to lower the temperature of the water to below 40 degrees centigrade or 104 degrees Fahrenheit. And blasphemy it is, because a lot of the people using skincare actually use skincare as, I would say, something that's akin to religious practices. Those are religious rites. A lot of people strongly and deeply believe that what they're doing is actually God-given practices, and they need to take care of the skin in that way, or basically their skin will go to hell. So that is blasphemy. The second thing that really annoys me, and that's not the person coming in, that's just the fact that the prescription is out there in the air, is the so-called cleansing, the need to cleanse the skin. That is a very complex phenomenon. But when you really bring it or boil it down to the basics, what people do with their skin from head to toe is they use two categories of products. One is the chemical abrasive category, which is soaps, detergents, washes, cleansers, and so on. And then they use a second category of products. Many of them use that, which is the physical abrasives, which are the scrubs, the loofahs, the exfoliants, the brushes, the washcloths, the gloves, and whatnot. And both these categories of products actually, especially when you use them indiscriminately on the skin, can lead to skin damage. They strip off the protective layers, the upper protective layers of the skin, and they put the user at a deficit right after using these products. And by the way, water does that on its own, only a whole lot less effectively than those two product categories do. So they kind of add insult to injury by using these products on top of that. And they do it, by the way, as you pointed out earlier, with a very strong conviction, I'd say a religious belief or conviction that they're doing something that's essential to their skin or for their skin to survive and do better and get some sort of a nebulous health benefit. And if that's not enough, the third thing that really irritates me, and by the way, these practices, the hot water and the abrasive use of practices, these are all done automatically and pervasively. It's not like there's a whole lot of dialogue with the skin, which we'll get to later. But people do those things perfunctorily, they do them automatically, and they do them day in and day out without really giving much consideration to whether or not they're needed by their skin and what their skin is telling them. And that brings us to the third annoyance, which is that people believe they need to moisturize, many of them, from head to toe, or alternatively, they don't realize that they need to moisturize because, again, there's no real dialogue or understanding of what the skin is asking them. And there's a second category of people who don't moisturize at all, and they don't know when to moisturize or whether or not they need to moisturize. So it's either all or nothing. These are the three annoyances that I see in clinic.
One of the examples I use in clinic to explain to my patients this is I tell them, most human beings, for most of their lives, either because they're too young or when they become older, they cannot really reach the center of their backs. And if you think about it, that's the area that's neglected. We see it also in patterns of scratching, for example. And so I tell them, look, you are probably not, even if you think you're not really soaping or scrubbing or any of those practices for the center of your back, and neither have your ancestors. Yet no one has grown a horn, or there's no specific disease in the middle of the back or a hole that leads to the other side of the planet in the middle of your back. It's just fine without all these practices. So I think that's sometimes one way I try to get through to people that maybe not everything is needed. Of course, this is on the normal side we're talking. And just to kind of reframe the discussion for someone who just joined us, we're talking about normal skin, not about certain diseases that require obviously other interventions. So you kind of built the soapbox for me, and I'm happy to jump on it and speak. But these were some great examples. So let's move forward there and see, how do you help your patients think through this in a way that is educational and robust in the long run? It's easy to just make that mistake of giving them the same prescription to say, well, don't do that, but do that. But really try to understand, because as you mentioned, there are some subtleties. And I know you talk about the basic language of the skin, or skinese, or maybe I'm mispronouncing it, but maybe give us an introduction on how you approach that with your patients.
That's great. So first of all, you pronounced it perfectly. It is skinese, and it's a language or a term that I made up to really describe how to bundle together what the skin is telling you to do or not to do. And before getting through the skinese, a little blurb about, because as we discussed, this is a religious belief. I dare say it's a religious belief. And to a lot of people, it's a shocking revelation that they don't need to do these things automatically. And it's important to really explain how the skincare routine works, the average skincare routine. And what happens is that the skincare industrial complex, basically the big corporations, I think, are largely behind this promotion of this idea. They convince the user that there's something wrong with the skin. Then they promote the use of the abrasive products. The abrasive products create the need for the moisturizing products. And that's when you basically have a sales funnel that the industry creates. And I illustrate that to the patients just to show them what's going on here, while emphasizing that there is nothing inherently wrong with their skin that they need to wash off. In fact, the ingredients that are on the skin are necessary to maintain the integrity of the skin, of the surface of the skin, and probably below that as well. because inflammation can actually start off maybe at the surface, but it can actually dig in pretty deep into the skin and create a whole slew of problems for the user. So that needs to be explained. For a lot of people, it's a very shocking revelation, but just to illustrate that sales funnel, that approach and strategy that's exercised in the skincare industry is very important. And then we have to realize what is really happening with the skin. So what's interesting about skinese is that it's a pretty simple language to understand. And it starts off with the basic premise that when the skin is not suffering, when the skin is doing okay, it usually says virtually nothing. And when you really consider that, you can examine your own skin, and unless you're paying attention to any specific area of the skin, or there's a problem with it, meaning it's irritated or it's injured in some way, or there's another problem over the area, the skin will basically feel like nothing's going on. There's no continuous sensation that's transmitted by the skin. And that is one sign for people to basically not do anything or not do a whole lot. And the other thing is really learn to examine the skin and see what normal skin looks like. And normal skin looks like across the board. It doesn't really matter what skin type they have, meaning how dark the skin tone is or how old they are. Normal skin usually has a very subtle sheen to it, unlike the big commercials that'll tell you that this product will make your skin glow, which is really injuring your skin, just promoting secretions onto the surface of the skin after you've irritated the bejesus out of it. Normal skin usually doesn't transmit any sensations, and it has a very subtle sheen to it. It's not ashy or flaky. It's not crackly. It's not too oily in most cases, although that could be something that can come up in some cases, but it's a very, very rare thing for somebody to have naturally excessively oily skin. The normal skin transmits no sensation unless you pay attention to the body part or touched it, or there's some sort of a sensory change, meaning like a temperature change, or you rubbed up against an object or whatnot. And again, there's a very subtle sheen to it. It's not glowing, it's not shiny. So the normal skin is very important to understand. And then you look at what is irritating to the skin and how the skin is telling you that it's irritated. And the skin will tell you it's irritated in a number of ways. First of all, there is the sensation. I think that's the first thing that the skin will do when it's actually rubbed the wrong way, no pun intended, but that's pretty much what the skin will do. Is it'll transmit sensations such as itch or burn or tightness in some cases, especially you kind of hear that in people who cleanse, quote unquote, the face. They run into the tightness sensation, which, by the way, many skincare companies promote as giving your skin a wake-up call or giving your skin some sort of a rejuvenation push, which makes people believe that while they're harming their skin, they're actually getting some sort of a health benefit, some nebulous health benefit. There's no benefit to it. They're just irritating and injuring their skin. So it's important to note that when there is a sensation, especially a persistent sensation over a part of the skin, that is a message to, first of all, stop where you are, most likely back away from practices that you're engaged in that could be promoting that sensation. And third, observe closely and see if that sensation persists. Now, in many cases of irritated skin, and this could be skin that's irritated by virtue of the user applying skincare products to the area, or age, or genetics, or a combination thereof, or a skin condition that's actually occurring on the skin. I mean, like dermatitis or eczema, or psoriasis can cause that, or rosacea is a very big sensitive skin condition that definitely is associated with sensations and appearance of a different skin. The skin is usually reddish or pinkish, or in darker skin tones that can be purplish. And there is some flakiness in a lot of cases. The skin is actually, the upper layers of the skin are becoming flaky or crackly, and they don't quite look as you would expect normal skin to look. And in some cases, this is not so much usually a cause or a result of skincare, but in some cases where the skin is irritated, you would see what I call quote unquote pimples, or you would see pustules or reddish bumps on the skin, or all sorts of other manifestations that don't quite look like normal skin anymore, and they're persistent. And that would be another thing to pay attention to. Now, what's interesting is that a lot of people ask, so what do I do with that? And the answer is, first of all, obviously, as I said earlier, stop where you are, back away from anything that's gratuitous, that's unnecessary, that you're not sure is actually benefiting your skin. Back away from that practice. You're going to be better off that way. Consider what needs to be done here. Usually not a whole lot. Basically, rinse the area with tepid water would be your best bet, if anything. And if the condition itself calls for moisturization, which in some cases it does, you may apply a moisturizer. Moisturizer, the choice of a product is really, really important. A lot of people, and there's so many options available out there, people don't know which one to choose, which is really, really important. And that's another area that I counsel them on. And third, if things don't really improve within a reasonable period of time, it really depends on the person a lot of the times, but I'd say within days or short weeks, you probably need to seek help from the best, which is a dermatologist, which is a person who has amazing amounts of experience, very extensive amounts of training, and can actually oversee the problem, let you know where you went wrong, and steer you in the right direction so you can get your skin right back on track.
Yuval, I do want to challenge you on behalf of my patients, all right? Because they will say, well, Dr. Bibi, but when I wake up in the morning, I mean, you got to be kidding me. I have that feeling like the sleep, the night, I got to wash it off. I got to, remove, I feel like I have excess stuff on my skin. I got to get it off my face. What do you say to that?
Well, I usually tell them that there is not really anything to wash out the face, but they insist on washing the face. And by the way, I don't practice this myself. I don't wash my face. And by the way, gentlemen, I practice what I preach. Anything I tell my patients to do, I walk the walk. I do not give
Nice.
predictions that I do not follow. And I think it's really important as physicians for us to do that. But I always tell them, if you want to do something, you can always apply tepid water to your face. You don't need to cleanse. You don't need to scrub. In fact, doing these things is setting you up to fail from the get-go because you're stripping away. And I tell them the water itself is actually a very powerful cleanser, and it will strip off a lot of the oils, a lot of the more loosely connected ingredients off the surface. Water itself actually dilutes bacterial growth on the skin when applied. And I'm talking bacteria such as E. coli and Staph aureus. Those numbers can actually decrease. Not that those are present on the face in most cases, but the water itself is actually a very powerful cleanser, and you don't need to go the extra mile to further aggravate the situation and irritate your skin. And by the way, that's for people who also have completely normal skin on the face. Why aggravate yourself, or why put yourself into the hole when you really don't have to and there's nothing to cleanse? And some people are convinced by it, some people are not. Again, this is a very deeply held belief. And when you consider
Right.
people coming to see us in the clinic, these people have been holding on to this belief and practicing those religious rites, if you will, their entire lives. And not only that, it's a generational thing. We're talking about the skincare culture that we're witnessing today
Right.
has been in the making for probably over 100 years, and it's been ramping up and ramping up. And it's all pervasive now with the explosion of social media and other modes of media, as I discuss in the book, by the
And
way. This is a very powerful force to tackle, and a lot of people are greatly, greatly captured by this, and they tend to do what they do. But I can give them the information and obviously hope that they'll take it and do what's best for them with it.
I agree with you. I think social media does magnify it, but it probably existed for millennia before because, I think some of the stuff that maybe you find in your local drugstore or maybe you find in some malls or you find on social media, a lot of this has been propagated for generations before any of that existed with various practices kind of going back to the cultural roots. But we started with the morning challenge. I want to give you the afternoon or after work or evening challenge. And that will be Dr. Bibi, but I have makeup on my face. How do I take that off?
Yeah, that's an excellent question. And I do appreciate the fact that people need to wear makeup, women need to wear makeup, and that's something they enjoy doing. And what I tell them is, first of all, I do tell them that they're better off using powdered makeup or water soluble makeup. But if they have to use whatever it is that they have to use, and everybody's got their own needs, their own complexion, they can actually, and they're much better off, first of all, avoiding using the so-called makeup removers, the industrial makeup removers that are usually either some sort of an emulsifier or an alcohol-based product or a detergent. And these are all abrasive to the skin. And my recommendation, which I've seen work really well in clinic, is for the woman to use either coconut oil, and I mean extra virgin organic coconut oil works really well. It has significant traction that can actually pull away the makeup. And what they can do is just massage or wipe the makeup off, rinse off the residue. Coconut oil is actually an excellent moisturizer. You can leave the residue on the skin, Most people do not get irritated by it. A small number of people do. And for those that are sensitive to coconut oil, I recommend using sunflower oil. The removal is very easy. She can do it with her own bare hands. She can use a cotton ball. She can use a dry makeup removing pad. And that is a very easy process to remove the makeup and not incur the damage that makeup removers actually inflict on the skin, which is again disrupting the upper layers of the skin, kind of throwing the baby with the bathwater. You remove the makeup, but you also remove the upper layers of the skin and induce damage, which in turn requires a moisturizer. It's another one of those tiny fireman's arsons right there.
Well, all right. I think I'm satisfied. I think these are some of the common questions I would imagine my patients would have. So now let's move to the next question. As you mentioned, some people do need to maybe moisturize every now and then
Right.
or other approaches. Can you tell us how to do this and what are your tips on doing this in a cost-effective manner?
Right. And I'd like to back away a little bit from just the moisturizing. The cost effectiveness comes from the fact that the patient that I counsel, I expect the information that I give them to actually give them a very comprehensive approach to how to understand the skin in the first place, meaning back away from the abrasive practices, which is in itself a huge saving of time and money and product and heartache and ultimately skin damage. So that is one aspect of the cost effectiveness of the whole overview of this. And then moisturization. So my take on moisturization is that you need to moisturize only what is dry or sensitive and irritated. And that needs to be done judiciously, meaning whenever the skin tells you that it needs to be moisturized. So it's not an automatic process. It's something that's actually carefully coordinated and carefully applied. And there needs to be some attention paid to the skin. And by the way, irritated skin or sensitive skin will tell you it needs to be moisturized. First of all, if you have ashy skin, you need to moisturize. It'll tell you that. That's what the skin is saying to you. If you have skin that's crackly or cracked or flaky, that skin needs to be moisturized. If you have an area for people, for instance, suffering from rosacea, if their face is glowing red and is burning, that is, and a lot of people don't realize this, rosacea may not be a purely dry skin condition, meaning you may not see the flakiness, you may not see ashiness on the face, you may not see these phenomena that you associate with dry skin. But functionally, rosacea is a dry skin condition, and I'll explain. Rosacea, or skin that's affected with rosacea, does not have the capacity to produce enough of those ingredients and hold on to them that protect the integrity on the skin of the skin on the surface. So functionally, it is dry skin. And what I've seen is that a lot of people who have rosacea, especially during those rosacea episodes, they greatly benefit from moisturizing the areas that are affected just to take the edge off that burning sensation that they experience. And in a lot of cases, calm that redness, that blush down just by virtue of moisturizing the area, obviously backing away from anything that makes them worse in the first place, but actually moisturizing very, very delicately those areas. For people who are known to have sensitive skin, whose condition is known to outbreak every so often, those people would definitely benefit from moisturization. And I think they can start off by maybe doing so. Those people may be in that category where they would benefit from moisturizing maybe twice a day. I think it's very important to stress that the most important time of day to moisturize would be nighttime for a lot of people, especially people living in dry climates. And by dry climates, I don't mean necessarily people whose outdoor climate is dry, but people who actually live in dry climates. And for instance, Florida is very peculiar. South Florida is highly humid and hot, but most people live indoors most of the time. And their houses are AC 24/7. There's no humidity inside the home. So that's a very dry environment. So it's important to pay attention to that. So the most critical time of day to moisturize, especially for people with sensitive skin, would be right before bedtime, where they can actually lose a whole lot of moisture to the room air while sleeping and not being able to keep up with moisturization. And I agree with you. People who have this impending sensitive skin issue that could turn against them at any moment, those people would definitely benefit from moisturizing. And by the way, those people usually have a clear sign, they usually are showing clear signs that the skin does need to be moisturized. So people who are atopic, people who have atopic dermatitis usually have dry skin that precedes that. And that's a clear sign for them to moisturize and to keep up with it, by the way. And so I always tell them, obviously pay attention to the skin. If you have the impression that you need to moisturize, then yeah, you probably need to moisturize. If you know your own skin, you know it's going to break out. If you don't keep up with this, by all means, moisturize. Stay current on the application. Bedtime is really important. And by the way, another tip that's great is to tell them to incorporate a humidifier in their bedroom, because that can also help prevent or decrease the water loss that takes place during bedtime or nighttime when the person's asleep. And then in the morning is another critical time to apply a moisturizer. There's obviously some moisture loss from the skin. You're going off to your day, you're about to face the day, and you're better off going into the day if you have sensitive skin, moisturizing the skin, putting that protective layer of occlusive emollient moisturizer on your skin, and setting yourself up to succeed for the rest of the day.
Well, Dr. Yuval Bibi, you have converted us. We are now in your camp of do less, do no harm to your skin. Thank you so much for taking the time and guiding us through some of the rationale behind this philosophy that I think most of us in clinic see quite a bit, and trying to coach our patients on how to achieve more with doing less. And by the way, saving some money by doing that. And if you saved a buck, you may want to spend it on Dr. Bibi's book. You can find his book on Amazon. It's called Sick Skin. And thank you again for your time and your expertise, and looking forward to further conversations.
Thank you, gentlemen, for having me. I greatly appreciate your time.
Guess what, Hadar?
What?
Tickets are selling fast for the 6th Annual Integrative Dermatology Symposium.
Wow, that's amazing. You know, each year this event gets better and better.
Yes, it does. And as a special gift to our podcast listeners, we're offering 15% off registration using the code PODCAST15.
Wow, that's a great deal. And prices won't be going any lower this year, so best to get on it now.
So true. And if you haven't joined us in person yet, this is the year to come have fun at the Grand Casino Resort in Reno, Nevada.
Yep, you'll get to connect with practitioners, engage with exciting research and content, and learn what the integrative movement is all about. Now, all this while nestled between the Sierra Nevada mountain range and downtown Reno.
All that nestling sounds skin-tastic. I know we're all about having fun at the symposium, but this year is over the top. Now look, I'm not much of a golfer, but they have over 40 courses along with rock climbing, equestrian trails, boat tours to Tahoe, pools, arcades. You get the picture, so much more.
Yes, it's definitely a family-friendly getaway. And while they are at the movies, we'll be feasting on, well, no pun intended, but nutrition.
My appetite is whetted. This year's theme has been long awaited. Nourish the gut, nourish the skin as we delve into nutrition.
We can't wait to see you this October 27th through the 29th in person or virtually.